Good afternoon, and thank you for joining us for a live teletown hall with Congressman Scott Tipton to discuss COVID-19. Today, Congressman Tipton is joined by three special guests who are actively coordinating response efforts on the medical and economic fronts in the state of Colorado. During this call, Congressman Tipton and these officials, who we will introduce shortly, will give brief updates on the continued state and federal efforts to flatten the curve, save lives, and mitigate economic impacts from this unprecedented national emergency. After the updates, we will have some time to answer questions from the audience. If you would like to ask Congressman Tipton a question or the guests at any time, please press 1 during this telephone town hall meeting, and you will be added to the queue. Before the speakers get started, I would like to take a brief moment to introduce today's town hall participants. We're joined by Congressman Scott Tipton, who represents Colorado's 3rd Congressional District, Dr. Eric France, who is the Chief Medical Officer for the Colorado Department of Public Health and Environment, Greg Dorman, who is the Resource and Legislative Director for the Colorado Department of Military and Veterans Affairs, and Dan Nordberg, who is the Regional Administrator for the Small Business Administration. Again, if you would like to ask a question of Congressman Tipton or the guests, please press 1 at any time during this town hall, and you will be added to the queue. With that, I would like to turn the floor over to Congressman Tipton for some opening remarks.
Thank you, Josh, and good afternoon, everyone, and thank you for joining our telephone town hall. I wanted to be able to give you an update on what we've been doing at the federal and the state levels to be able to mitigate one of the largest public health crises to face our nation. I believe it's very important to note that as troubling as these times are right now, we cannot stress the importance of remembering that this is temporary. And while it will be a while, it won't be easy, it will pass. We will get through this together, and the more we do now, the faster this will pass, and the sooner life can get back to resembling the normalcy that we all desire. My team and I are working around the clock to be able to address the needs of our communities throughout the 3rd District in conjunction with state and local leaders. We're in constant communication with the local healthcare providers, emergency coordinators, chambers of commerce, small businesses, and constituents as we do whatever we can to be able to get our resources to our communities. We're working with the administration and putting pressure on the federal agencies where needed to be able to prioritize the resources for rural Colorado. By now, hopefully, you've heard about the recently signed into law the CARES Act. The bill received bipartisan support in Congress and is designed to be able to provide emergency relief and resources to healthcare providers, hospitals, small businesses, and families. I supported it after talking with businesses, hospitals, and constituents across the district who are being severely impacted by the crisis. To put it bluntly, without federal action and emergency aid, hospitals and health clinics would have closed. Countless businesses would not survive, and families would not be able to make ends meet. Something had to be done fast to be able to save the economy and better position our communities to be able to recover once this is over. I was glad to see that several aspects of an outline I sent to the House leadership was added into the final text of the bill, including targeted relief for the community health centers, the establishment of the Paycheck Protection Program to support our small businesses and their employees, direct payments to families, and emergency funding for critical small regional airports, among others. Many of these provisions have already been established and will soon start to be able to make their way into our district. I'll be sure to keep you posted on the announcements as they become available. And while this bill is far from perfect, I believe it was a necessary step toward limiting the severity of the impact on our communities, on our families, and setting up a better path to recovery on the road ahead. As this is implemented, I'm in constant communication with the local chambers of commerce, state and local officials to make sure that everybody knows what resources are available and to be able to get feedback on where we still have work to do. I'm very glad today to be joined by our special guests who will update us on their work on behalf of the Colorado Department of Public Health and the Environment, the National Guard, and the Small Business Administration. I'd like to give my special thanks to Dr. France, Greg, and Dan for participating today, and for everyone that's taking the time to listen. I hope that you find this conversation to be both informative and to be able to be constructive as well, and look forward to answering some of the questions here shortly. And with that, I'd now like to turn it over to Dr. Eric France, Chief Medical Officer of CDPHE. Dr. France?
Thank you, Congressman, and thank you, everybody, for participating today. It's hard to believe it's been just over a month now since our first case of COVID-19 was diagnosed in our state on Thursday, the 5th of March. much of the work early on was to do everything we could to reduce the transmission. By doing so, we reduced the number of infections, the number of people that end up in the hospital and in the ICU. And our goal has been to, as much as possible, reduce the stress to our hospital systems. If we had done nothing, it's really something to think of what we'd be in the middle of right now. There would be thousands of cases every day of people ill with COVID in our state. At the peak, around Mother's Day, there'd be over 220,000 Coloradans who that day would develop COVID. All that between now and Mother's Day, if you could imagine. Instead, we've taken a number of important public health approaches to create physical distance between all of us. And as you know, it began early on with the state of emergency on the 10th of March, expanded to closing of bars and restaurants around St. Patty's Day, closings of schools statewide, no elective surgeries, until finally on the 26th, we had our stay-at-home policy come into effect. The governor announced yesterday that that policy will now be in place through the 26th of April. So the big question on everyone's mind is this having an impact? I think the most obvious way is that we aren't overrun today. We would already, as I said earlier, be seeing tens of thousands of people ill every day with COVID coming into our emergency rooms, coming to our hospitals. But instead, we've been seeing a steady rise in cases and hospitalizations, but not the exponential growth that takes you from 500 to 800 to 1,500 to 3,000. Nothing like that. Our cases seem to be around 300 to 400 a day. And after originally having an experience at the hospital of lots of cases coming in, I hear now from the Western Slope, from the Front Range, the hospital chief medical officers saying that they don't feel quite as overwhelmed as they did. There are indeed many patients in the hospital right now, many patients on ventilators, but their numbers aren't escalating, and they're being able to manage that within the hospital systems as they stand now. Well, so that's the good news. The good news is that all the hard work of physical distancing that's going on, it seems to be playing out with a reduced amount of transmission, and it's being able to maintain our hospitals and our healthcare workers. The challenges, as you know, are oftentimes supply chain. Do we have enough personal protective equipment for our healthcare workers and first responders? Do we have enough ventilators? Do we have enough ICU beds and hospital beds should they be needed? So there's a lot of work going on now to get both federal and local new sources for these material. So those are the big challenges, I think, that the hospitals are facing. We also know that in the coming weeks, we may see ongoing increases in these cases in our hospitals, and we're watching every day to understand what kind of burden might there be. Of the 136 hospitals in the state of Colorado, 100 of them are now providing us information every day about their use of hospital beds and ventilators. And as such, I believe we'll be able to keep track very carefully on what's going on across the state. So when might we be letting up some of these stay at home? Well, you heard the governor say the 26th of April is our goal. We're hopeful that we've found a nice suppression of the infection in our communities, and we'll move to a phase now where, with more testing becoming available, we'll use a strategy of isolating people who are sick and quarantining persons who've been exposed as a way of trying to keep those numbers down once we start to release some of these restrictions on our physical connectivity. It's important that even as we come out of this phase, that we stay masked when we're in public spaces, we keep distances, we consider our more vulnerable populations and whether they should potentially stay at home and avoid social areas, those who are older, those people with chronic medical conditions. We know it's going to be a life with coronavirus in our midst and still bubbling along while we try and live our economic lives. So it will be interesting to see the plan as we come forward. And with that, I'll stop and let the others speak before taking questions. Thank you.
Thank you, Dr. France. And for those of you who are just joining us, this is a Teletown Hall meeting hosted by Congressman Scott Tipton. If you would like to ask a question, Congressman Tipton or the guests at any time during this call, please press 1 on your phone keypad. With that, we're going to go to Greg Dorman, the Resource and Legislative Director for the Colorado Department of Military and Veterans Affairs next.
Thank you, Josh, and good afternoon. A big thank you to the Congressman and his staff for hosting this call, and for all of you out there listening for taking the time to participate. One of the best tools we have is knowledge, and right now with Dr. France and others, it's great to be able to share that knowledge with you, what we've learned as we work hard on this event. So today I'm going to talk really about our largest division in the department, which is the Colorado National Guard. First off, it's helpful to understand how we fit into that puzzle. The National Guard responds to requests from Colorado's Unified Command Center, which is located in the State Emergency Operations Center. We then provide the personnel and equipment needed to support the requests. To date, we have provided support for epidemiological testing as well as mission and logistical planning. I'm pleased to announce today that we're standing up Task Force Emergency Operations Center support, which will begin working this week. So the Colorado National Guard will be sending planners to support emergency operations centers in 11 counties, including Routt, Delta, Ouray, La Plata, Montezuma, and Pitkin. We are working 7 days a week and constantly communicating with the state's emergency managers in order to be prepared to respond to support requests as they come our way. And with this new task force, we'll be embedding some of our experienced military planners just to help plus up their staffs and give them more capacity to plan for both emergency events today and, as Dr. France alluded to, some of the actions we'll take in the near future. We maintain the capacity to continue to respond to other events like blizzards and wildfires while we're doing all this. In closing, I'd like to just remind you that communities that feel they need more resources from the state should use their local emergency managers to feed those requests up to the State Emergency Operations Center. On behalf of the Adjutant General of Colorado, Major General Mike Lowe, and the men and women of our department, I wish you all health and patience in these unprecedented times.
Thank you, Greg. And for those of you who are just joining us, this is a live Teletown Hall meeting with Congressman Scott Tipton, featuring a number of special guests from state and federal government agencies who are coordinating the COVID-19 response in the state of Colorado. With that, we're going to go to Dan Nordberg, who is the Regional Administrator for the Small Business Administration next.
Great. Thank you so much for that introduction, and good afternoon, everybody. First and foremost, I want to thank Congressman Tipton as well as his staff for their continued partnership helping small business during this time. And as we face this unprecedented challenge, obviously there are a number of things that the Small Business Administration is doing to be a resource and provide the capital necessary to help entrepreneurs at this difficult time. One program in particular that is gaining a lot of attention, and certainly you're hearing a lot about, is the Paycheck Protection Program. So I thought I'd spend my time talking about that a little bit today and making sure everyone has an understanding of what that program is. The program is for any small business with less than 500 employees, including sole proprietors, independent contractors, as well as other self-employed individuals. Private nonprofits, 501c3s, including religious organizations, as well as places of worship, are also included. 501c19 veterans organizations, and tribal business concerns. It is important to note that businesses in certain industries may have more than 500 employees if they meet the SBA size standards for those industries. One example of this would be businesses in the manufacturing industry, where you could have employee count of up to 1,500 employees and still be eligible. So if you think you may fall into one of those business categories where you are in an established SBA size standard, it is certainly worth double checking. Another exception to the 500 employee count in place for the Paycheck Protection Program is for businesses in the hospitality and food industry with more than one location, as long as they don't have more than 500 employees per physical location. So, for example, you could be a restaurant owner with 4 restaurants and 200 employees at each of those locations, and that would still be acceptable. Now, in terms of loan amount you may receive, it is determined based on a formula of your average monthly payroll from the year prior and multiplied by 2.5 or $10 million, whatever is the lesser amount. For most instances, it's going to be the lesser amount as determined by that formula. Now, since this is an employee retention measure, the loan has some very prescriptive uses as to what you can use it for. Payroll support, employee salaries, paid sick or medical leave, insurance premiums, mortgage, rent, and utility payments. Now, it's important to note that these are not direct loans from SBA. The interface and the point of entry for this program is with your lender, and that's intentional. Private lenders are going to be able to get capital out to you much faster than a direct loan from the federal government. So when you look into inquiring with lenders about this program, please know that any insured bank, credit union, as well as farm credit institution are eligible to do these loans. For eligibility purposes, instead of requiring lenders to determine repayment ability, which is really difficult during this crisis, we are asking that the borrower certify that they were a business operational on February 15th, 2020, and had employees for whom they paid salaries and payroll taxes, as well as certifying on a statement that the current economic uncertainty makes this loan request necessary to support their ongoing operations. There are no borrower fees to participate in the Paycheck Protection Program. There is no credit elsewhere standard. There is no collateral or personal guarantee requirement, and borrowers will also not be charged any prepayment fees. The maturity for the loan is 2 years, and the interest rate is 1%. And all of this loan is guaranteed 100% by the federal government. To further help small business owners and provide relief during this difficult time, SBA is allowing deferment of payments on these loans for at least 6 months. So that should provide some support. Now, the primary feature of this program is loan forgiveness. The statute establishes that the borrower shall be eligible for loan forgiveness equal to the amount spent by the borrower during the 8-week period after the origination date of the loan for payroll costs incurred as compared to the prior year. So there will be a year-to-year comparison of your average FTE payroll, and your loan forgiveness will be proportionate to maintaining employees and wages. The amount forgiven will be reduced proportionally by any reduction in employees retained compared to the prior year, and reduced by the reduction in pay of any employee beyond 25% of their prior year compensation. Last but not least, 75% of the loan must be used on payroll in order to receive the full loan forgiveness. So that does leave the remaining 25%, which can be used for mortgage, rent, and utility payments. So it's important to note in closing here, this is a 10-day-old, $349 billion loan program. As such, additional guidance will be continuing to roll out as it pertains to eligibility and definitions for inclusion. But please know we are working around the clock to support your small businesses, and I'd welcome any questions at this time.
Thank you, Dan, for those comments. And for those of you who are just getting on the call, this is, again, a live teletown hall meeting with Congressman Scott Tipton, with Dr. Eric France from Colorado Department of Public Health and Environment, Greg Dorman from Colorado National Guard, and Dan Nordberg, who is with the Small Business Administration. Right now, we're going to go to some of your calls. Again, if you would like to ask a question of any of the participants on this call, please press 1 on your phone keypad, and we will add you to the queue. For this first question, we're going to go to Christina Brown in Durango. Christina?
Yes, thank you, Congressman Tipton, for hosting this town hall today. I'm just curious what is being done to prepare rural Colorado, such as Durango, for the influx of patients, as well as securing more readily available testing for COVID. Thank you.
Well, thank you, Christina, and I appreciate you bringing that up. I was on a phone conference again this morning with Governor Polis to continue to advocate and to point out at each one of the phone conferences the importance of remembering rural Colorado. As Dr. France can probably attest, we have fewer hospitals, greater distance, and fewer providers, ultimately in our rural areas, which pushes a greater burden actually out onto some of our medical professionals to be able to deliver the service that's going to be necessary. We are still trying to address on the national end the ability to be able to get testing out in the quantity that's going to be necessary. We're advocating to make sure that we are getting the delivery and the production of the personal protection equipment to be able to keep our healthcare providers as safe as possible, and also to make sure that we're getting the funding into our rural community hospitals to make sure that they're going to be able to keep the doors open. As has been noted, a lot of the elective surgery is currently being canceled, greatly inhibiting the cash flow into the hospitals, which was necessary to be able to maintain their viability. So we're advocating at the state and the federal level to get those resources into our areas to make sure that we're not forgotten in the process. And it's with all due respect to some of the plight that is certainly being experienced in the metropolitan areas. Our people, our communities are equally important, and we're going to continue to advocate strongly for them.
Congressman, thank you. That was excellent. And I would just add that I should call out the high degree of cooperation and connectivity across hospital systems in the state of Colorado right now. They are working together, talking in a way that they really never have in the history of the state, at least the last 30 years that I've been here. So the ability to understand the needs across hospitals, to be able to move equipment, ventilators, and other material across hospitals is really at an all-time high. There's work underway to identify potential alternate hospital space that the National Guard and the U.S. Army Corps of Engineers are looking at sites where there potentially could be building more beds, and that includes the Western Slope Mountains and the Front Range.
Thank you, Dr. France, and thank all of you for joining us this afternoon. This is a live Teletown Hall meeting with Congressman Tipton and a number of special guests from the state of Colorado and federal government who are coordinating the COVID-19 responses in Colorado. If you would like to ask a question at any time, please press 1 on your phone keypad. For our next question, we're going to go to Joshua in Dolores.
I had 3 questions I wanted to ask real quick. One of them was due to the stimulus plans that they got going out for $1,200 per person or whatever it is, they said they was going up of income tax, and whether it be mailed, however you got it, whether it was mailed to you or direct deposited. What about the ones that have Emerald cards, that they have that money applied to their cards? The second question is we had a cruise that was booked here a while back, or not booked, but we was paying for it, and it got canceled due to the coronavirus, which, thank God we're all in our good health and everything. But they withheld the money from us and won't extend it out on top of that. And then the third question was due to all this stuff that's been going on as far as the coronavirus and everything else, me and my soon-to-be fiance, we've been quarantined to our house since day one of all this stuff. Not forcefully or anything else. We just took it upon ourselves to stay in our homes and everything else and not go out around people. So how long is this going to carry on? Is there going to be a peak, or do they even know if there's going to be a peak that comes to the Colorado area at all? Or where are we going with this on the outcome of it?
Well, thank you, Bill, and appreciate you bringing that up. Treasury is looking at the different delivery methods for the individual payments that are going out, trying to take in all consideration. They're in discussion right now with Visa, MasterCard on alternative delivery methods to be able to get those dollars back out to people who may well need them, given unemployment challenges that are faced, and for businesses as well. We've heard a variety of concerns over the cruise industry, over the airline industry, in terms of issuing vouchers, but holding on to money that was already put in. I know there'll be some ongoing discussions with those businesses on how to best be able to handle it. In regards to the self-quarantine, for how long, I'll probably defer to Dr. France. We are still monitoring the numbers. I don't believe, per the governor, that we've determined that we've reached the peak yet in Colorado. And I think the more we practice the shelter in place to be able to keep the separation, we're going to be slowing the speed and closing that time frame. Right now, the governor has targeted April 26th to hopefully be able to start lifting some of these restrictions. But Dr. France, do you have any further information on that?
Yes, it's a lot of people are asking that question. When will this peak be there? And I can't help but think about the dandelions in my lawn. And if I hit them hard in the spring when they're first coming up, then I can kind of manage them through the summer, and I'll see them pop up here and there, and the numbers will be under control. If instead I let them kind of run amok early in the spring, then of course they're everywhere, and their seeds are everywhere, and it becomes more difficult to control through the summer. And what we're doing now is essentially like controlling all those dandelions really hard. And hopefully we won't really even have much of a peak, because there'll just be we'll hit it down so hard, this virus down so hard now, and then we'll maintain those low levels of infections going forward. Peaks that are tall and high and then drop quickly will overwhelm our healthcare system. And if we weren't doing anything, that peak would be hitting right around Mother's Day, and we'd have hundreds of thousands of people, and it'd be over in 3 months, though. So instead, we're pushing it down. We'll probably see this go on 5, 6, 7 months with cases, but at these lower levels that we can manage in our hospitals. So it's great that you're staying indoors. You're being careful about quarantining. I want you to keep doing that. I hope you're getting outside to walk a little bit in the neighborhood and get some exercise. Wear a mask. Keep 6 to 10 feet away from people. Get outside and enjoy the weather when we have nice days like this. But recognize that it's going to be intense time now of staying at home, and then we'll be releasing it in some fashion, hopefully by the end of this month. But it won't be all business as usual again, because the virus might come right back up, just as if you didn't pay attention to those dandelions in your lawn.
Thank you, Dr. France. And Congressman Tipton, for those of you who just got on the call, this is a live teletown hall meeting with Congressman Scott Tipton. And just a reminder, if you would like to ask a question at any time, please press 1 on your phone keypad. For our next question, we're going to go to James in Pueblo.
Congressman, I own a small business that is under an S Corp, and basically we do home improvements. I'm the only employee within the actual corporation. I own it 100%, and we hire subcontractors. And so basically I'm self-employed and don't really take a salary. We just take the profits at the year end and transfer that over as far as from our S Corp to our personal. How do we go about being able to cover that? What's available for us on employment or what?
Well, thank you, James. And this is some of the complexity of different business models that we do have within the country. Probably effectively, and I may have Dan, if he would be kind enough to be able to jump in on this as well. Effectively, what you take as a disbursement would probably be deemed as salary that you're taking out of the business. LLC, sole proprietorships do qualify for the PPP to be able to be addressed. And Dan, do you have some direct knowledge on the specifics of James's question?
Yeah, thank you, Congressman. And James, great question. You know, you are absolutely eligible for this program. There is a formula that you would have to utilize specific to being the sole employee and as well as an S Corp. And if it's possible, I'd love to walk you through that personally after this phone call, just to make sure you have the information you need when you go to apply for the Paycheck Protection Program. But you are eligible, and there is a formula with respect to your certain circumstance that will determine the loan amount.
And Josh, if we can capture James's number and get that to Dan, I'd appreciate that.
Yep, absolutely. I took a note here, and James will follow up after the call is over and connect you with Dan. All right. Thank you, everybody. For our next question, we're going to go to Frank in Pueblo.
Hi, Frank.
Hello, this is Frank. This is Frank Turner from Pueblo West. I'm curious. You mentioned about walking. Are we able to walk in the mountains or go up into the mountains, and as long as we're not around other people, or and also combined with that, can we go to the reservoir if we're not around other people and go fishing? Is that possible as long as we're staying away from other people with family members, like 1 to 4 family members? And if we're driving to those places, would we get a ticket?
Frank, you can go fishing, and I think Dr. France, as he had noted, just being able to keep some of that separation between you and people that may also be outdoors. You still do have the opportunity to be able to get out and walk. Some of our parks have been closed just because some of the crush people that were coming in. But I think it is important to be able to get outdoors. And Dr. France, do you have some comments on this?
Thank you, Congressman. Mr. Turner, yes, I'm a big fisherman as well. I would be careful about being in a place where there's likely to be a lot of people. I note myself that I've sometimes gone out thinking, oh, well, things are quiet and I'll go out to this spot, and it might be a favorite place to go for a walk or something, and find that there are all these people out there already, and then I start thinking, well, maybe this wasn't such a good idea. So maybe give some consideration to where exactly you'll be going, and will you be finding that there's quite a few people there seeking the same thing as you. And for that reason, I would say that in general, it's discouraged to maybe go to places where you think there'll be potential groups of people and crowds of people in that regard. I don't believe you would get a ticket at this time for driving for that.
Thank you, everybody, for joining us this afternoon for this live Town Hall meeting hosted by Congressman Scott Tipton. Again, if you would like to ask a question at any time, please press 1 on your phone keypad. For our next question, we're going to go to Debbie in Pueblo.
Hi, Debbie.
I just wanted to ask the homeless people if there's one of them that needs to come and be with their children that I have custody of. Can I leave their shoes outside and then pick their clothes and wash them? They go in the shower. Is that good enough to keep their children from getting exposed?
Josh, on my phone, that wasn't really coming through. Could you maybe repeat that if you were able to hear that?
Yeah, Debbie.
With the congressman.
Yeah, Debbie's question was basically she's concerned about the homeless situation and what's being done. She has relatives or personal experience where she knows someone who has grandkids or parents that are homeless and isn't sure if it's safe for them to visit.
We do have concerns, Debbie, about the homeless issue as well. I'd actually put in some legislation to make sure that we are getting communication between various agencies to be able to identify the homeless populations, to make sure that we are going to be getting adequate medical care, because that could certainly become an area where the disease could spread easily. In terms of probably going over to visit family members, I think some of the isolation, just given if you've got grandparents, depending on people's exposure, you'd want to be very cautious about that. And Dr. France probably has some good information on this as well.
Congressman, thank you. Yes, I agree that it can be a challenge to think about how do we spend time with family and have the opportunity to see them if we're all being asked to sit in isolation. Certainly clear we want to keep our circles small. I've heard some families say to their young children who are living out on their own and still doing a lot of socializing that, hey, I don't want you to come over to the house right now because while the chance of you having any serious illness with this is very low, you could be bringing it to me, and as an older person, my risks might be higher. So you might think about the context of who's coming over and how much have they been mostly isolated themselves, and if they have, then coming over to see you and you've been mostly isolated, then the chances are really low that anybody's going to be sick there. On the other hand, if you're in a job where you as an essential critical worker, you're out and you're engaging with people, then you may not want to go and have face-to-face time with an elderly parent who then might be more at risk. So you'll have to judge it based on your understanding of the risk and how much you're out there and potentially being exposed, or the people coming over might be exposed out there before they come to see you.
Thank you, Dr. France. For our next question, we're going to go to Darren in Ridgeway.
Hi, Darren.
Hello. Yeah, I was just curious on the PPP program. Wells Fargo had led everyone to believe they were going to open up an online process to apply, and it didn't happen. It was kind of classic Wells Fargo of the site never went live, but the applications are full. So now, trying to go elsewhere to find a source, to handle the PP. So just curious about how that could happen with such a large bank, or if that could get looked into.
Yeah, be more than happy to be able to bring it up with Wells Fargo. All of our banks, community banks, can actually go ahead and take those applications to be able to be put in. Came out of the Senate today. That Leader McConnell is looking at making sure that we have enough resources to be able to meet some of the demand that's going to be there. But each bank, if you've got a personal relationship with another bank, they can certainly do it. Even if you don't have a personal relationship with a bank, that does not prohibit you from being able to make an application with financial institutions. There were some problems with the E-Tran, the system to be able to communicate for the applications going in. They are working on that to be able to help facilitate that. And if I guess maybe some of the best knowledge, if it isn't immediately available today, to be able to get that in tomorrow or the next few days, those applications will be accepted. And Dan, do you have some comments on this as well?
Congressman, I think you answered that really well. I think the only thing I'd just reinforce is that, again, this program is open to any insured bank, credit union, and farm credit institution. And I know a lot of people, will traditionally think of the larger banks, but I would just say that a number of community banks in our state, as well as smaller credit unions, are really stepping up to help meet this need and support entrepreneurs. So we'd like you to keep that in mind as you're looking to make applications somewhere else.
Thanks, Dan. We're going to hurry up and try to get through one more question here. We are drawing near the end of our call, but we have time for one more question and then some closing remarks. For those of you who were waiting to ask a question in the queue and didn't get the chance, we encourage you to go ahead and please follow up with the office. We will try to get back to you as quickly as possible. If you want to talk to a staffer directly, please feel free to give them a call at any of our office locations, which can be found on tipton.house.gov, and I'll speak to that a little bit more here in a minute. But first, we're going to go to Drew in Parachute.
Hi, Drew.
Hi, thank you for taking my question. I just had a question about, very similar and builds off earlier questions about the shutdown and when we're getting back. Because I'm looking at the model, the IHME model from the University of Washington, which is touted as being very credible. Their numbers match what the Colorado Public Department of Health are putting out, and that suggests that our use of peak resources was April 4th, and that we're looking at a total of 302 deaths through August 31st. Now that, of course, assumes that we're all going to be behaving ourselves and staying indoors until the end of the month. But I'm just curious what's going on, because people keep saying that things are going to get so much worse and the model suggests otherwise. Do you have data that they're not getting or that we're not getting?
Drew, I appreciate you bringing this up because there is discrepancy between the University of Washington and what we're hearing out of CU. I think what we all need to be hopeful for is actually the modeling is off, that we're going to come in with lower infection rates and lower hospitalization, incubation in terms of patients going in through some social separation, which we've had, and good hygiene practices to be there. We had this conversation actually with the governor and our congressional delegation this morning to be able to get some clarity and to be able to make sure that we are getting good communication going throughout all of the studies that are going on to be able to reflect the real numbers, the real impacts. And I would suspect, frankly, as we get more testing, we will find that there's probably more infection. It may be less or more impactful given the individual and medical conditions and age in terms of what they're going to be facing. But that's where the communication and sharing of information does become critically important, and the modeling is modeling. And I think all of us and our hopes and prayers are that the high-end numbers are going to come in lower than what is actually going to take place, simply with us all working together to be able to fight back against something which we've never experienced, to have no antibodies for, to be able to fight back, and to make sure that we're doing the best we can to keep ourselves and our families and our community members healthy. Dr. France, do you have some comments on Washington versus CU studies?
Thank you, Congressman. Well said. I would maybe just say that we're fortunate to have a talented team of thought partners, scientists at the University of Colorado School to build a model based on our own data. I've highlighted that yesterday, based on that IHME model, the model suggested the peak use of ventilators would be 119 as of April 6th, yesterday. I know there were at least 300 people on a ventilator in Colorado, if not more, due to COVID. So the numbers that they've been using are a little bit different than what our modelers are saying here. The hope, too, is that if we have reduced viral transmission by 80%, then actually the peak of infections would have been around the 1st of April per our Colorado modeler. So the challenge there is that how do you keep it that low going forward and not see some rise again in the future? And that's where we're now thinking and working closely with CU to estimate what kind of interventions it would take to keep our transmission rates that low going forward so that we don't peak, we don't overwhelm our hospital systems.
Thank you, Dr. France. And we have reached the close of this call. If you wanted to ask a question, but we're not able to get through, we did have a number of folks who were waiting very patiently. We invite you to please go ahead and give one of our regional offices in Pueblo, Grand Junction, Alamosa, or Durango a call. The numbers for those offices can be found at www.tipton.house.gov, or you can also send us an email if you would prefer that method as well. We will get back to you as quickly as possible. Staff is working full-time here. A lot of physical locations of the office are closed to keep in accordance with social distancing and the stay-at-home orders. Everybody is working around the clock remotely. We will also encourage you to visit the COVID-19 page on tipton.house.gov, where we have compiled resources and information about federal and state response efforts, as well as health information from CDC, CDPHE, and other agencies, as well as frequently asked questions section. With that, we will go ahead and turn it over to Congressman Tipton for some closing remarks.
Well, thank you, Josh, and I want to thank all of you for taking time to join us today. And my special thanks to Dr. France, to Greg Dorman with the National Guard, and Dan Nordberg out of the SBA for lending their expertise to this conversation. This is something that we hadn't anticipated, and very difficult to plan for the unanticipated, but I believe we're working as hard as we can to be able to try and address this COVID-19 impact on our communities, our families, and our businesses as well. I would encourage you to be able to go to our website where you can find COVID-19 resource page for updates on the virus. And also ask that you sign up for our newsletter, which is going to provide further information on the work that we're doing in Washington and around the district. If you do have any questions, again, after we disconnect, please give our office a call at 202-225-4761 or go online to tipton.house.gov. Again, that telephone number is 202-225-4761. And thank all of you for joining us, and God bless you and keep your families safe. Thanks again.